What's going on, guys? It's Humphrey here, and today we'll be talking about different cardiovascular diseases and describing them and stuff like that. And I will be putting helpful tips or websites and stuff so you guys can get more information if you need it. I hope this video helps. Alright, the first one is heart disease. Heart and blood vessels disease, or also called heart disease, includes numerous problems, many of which are related to a process called atherosclerosis. I think that's how you say it. I'm not sure though. Is a condition that develops when a substance called plaque builds up in the walls of the arteries. This buildup narrows the arteries, making it harder for blood to flow through. If a blood clot forms, it can block the blood flow. This can cause a stroke or a heart attack. The next one is heart attack. A heart attack occurs when the blood flow to a part of the heart is blocked by a blood clot. If this clot cuts off the blood flow completely, the part of the heart muscle supplied by that artery begins to die. Most people survive their first heart attack and live and return to their normal lives, enjoying many more years of productive activity. But experiencing a heart attack does not mean that you need to make some changes. The medications and lifestyle changes that your doctor recommends may vary according to how badly your heart was damaged and to what degree of heart disease caused that heart attack. The next one is stroke. Arrhythmic, I'll put it on the screen. It's the most common type of stroke. It occurs when a blood vessel that feeds the brain gets blocked. It's usually from a blood clot. When the blood supply to a part of the brain is cut off, some brain cells will begin to die. This can result in the loss of function controlled by that part of the brain, such as walking and talking. A hemorrhagic stroke occurs when a blood vessel within the brain bursts. This is more often caused by uncontrolled hypertension, high blood pressure. Some effects of strokes are permanent if too many brain cells die of being starved of oxygen. These cells are never replaced. The good news is that sometimes brain cells don't die during strokes. Instead, the damage is temporary. Over time, an injury cell repairs themselves. Previously impaired functions improved. In other cases, undamaged brain cells nearby may take over for the areas of the brain that were injured. Either way, strength may return, speech may get better, and memory may improve. This recovery process is what stroke rehabilitation is all about. When it comes to spotting strokes and getting help, the faster the better. That's because prompt treatments may make the difference between life and death, or the difference between a full recovery and a long-term disability. Use the letter in FAST to spot a stroke. I'll put FAST somewhere on the screen and down below. F is for face drooping. A is for arm weaknesses. S is for speech difficulty. And T is for time to call 911. Heart failure. Heart failure, sometimes called congenital heart failure, means the heart isn't pumping blood as well as it should. Heart failure does not mean that the heart stops beating. That's a common misperception. Instead, the heart keeps working, but the body needs for blood and oxygen isn't met. Heart failure can get worse if left untreated. If your loved one has heart failure, it's very important to follow the doctor's orders. Arrhythmia, referred to an abnormal heart rhythm. There are previous types of arrhythmia. I'll put it on screen so you guys know what I'm talking about. The heart can beat too slow, too fast, or irregularly. Bradycardia, or a heart rate that's too slow, is when the heart rate is less than 60 beats per minute. Tachycardia, or a heart rate that is too fast, refers to a heart rate of more than 100 beats per minute. And arrhythmia can affect how well your heart works. With an irregular heartbeat, your heart may not be able to pump enough blood to meet your body's needs. Heart valve problems, when heart valves don't open enough to allow the blood to flow through as it should. A condition called stenosis results when the heart valves don't close properly and thus allows blood to leak through. It's called regurgitation. If the valve leaflets bulge or prolapse back into the upper chamber. It's a condition called prolapse. Some common treatments for different types of cardiovascular diseases: heart valve problems, medication, heart valve surgery, medication and pacemakers, heart attacks, medication such as clot busters, coronary angioplasty, coronary artery bypass graft surgery, a stroke, medication, and the next one I will put on the screen because I don't want to butcher that name. Diagnosis, tests, and surgical procedures and medications. In the hospital and during the first week at home, the doctors may perform several tests and procedures. These tests help the doctor determine what caused the stroke or heart attack and how much damage was done. Some tests monitor progress to see if the treatment is working. Cardiac medication. The medication prescribed in the wake of a cardiac event can aid in recovery and work to prevent another stroke or heart attack from happening. If you're a caregiver, make it your responsibility to help your loved one take medication as directed and on time. Educate yourself about the medication that your loved one must take. Know what those medicines do and what their goal is to do. Then it says it's important to follow your doctor's instructions, and if you have any questions, just don't hesitate to ask them. I love you guys. I hope this has helped you. And I know it wasn't funny. I'm sorry, guys. Like, my girlfriend's over there, and she was like, I love you guys. Hope this has helped. If it did, make sure you give it a thumbs up, subscribe, share with friends, turn your post notifications on so you never miss out. And if you want to see like any other diseases, let me know down below. And I will see you in the next video. Stay safe.